I'm going to be telling you the steps for assessing body temperature, skills 2/1. 2-1. Okay. So I walk into the room, introduce myself, wash my hands, look at the patient chart, explain to them what I'm going to be doing, that I'm going to be taking their temperature, and along with their other vital signs. I will provide privacy, and I will more than if I'm doing first of all, start it with oral. I'll gather my supplies so I have everything I need, no matter what kind, if I'm doing oral, tympanic, temporal, axillary, or rectal. I will have all that with me. I'm going to wear gloves, any other PPE necessary, because you come in contact more than likely with some kind of bodily fluid or stool or whatever. So I will start with oral. I will get my automatic thermometer out. I will remove it from the holder. I will put a plastic cover on till it clicks. I will pull it out. I will tell make sure it's on, make sure it's 0. I will tell the patient to open their mouth, and they will have to put it under their tongue back in the sublingual pocket, posterior sublingual pocket. Close their mouth around it. Do not bite the probe or the thermometer. Hold it there until it beeps. Get the oral reading, remove it from their mouth, dispose of the probe cover, put it back into the thermometer machine, put it back, remove my gloves, wash my hands, cover them up, provide privacy, put them into the position that they want to be in, and exit the room and go and document the temperature. I will be just going through all the same steps, doing temporal. Temporal is in the ear. I will get the thermometer and everything that I need. I'm going to do all the same steps. I'm going to introduce myself. I'm going to look at their chart, see if they need their temperature taking, what route to do it. I will, put my gloves on and tell them what I'm doing. I will get the temporal, I will get the tympanic. That is for the ear, the tympanic thermometer. I will put the probe on the top, make sure it's on, pull the top of the ear up and out, aim it towards the eardrum, get a nice tight seal, push the button, and wait for it to beep, read what it says, eject the cover, put it back in the holder, go through the same steps, put the patient in their position that they want to be in, take my gloves off, wash my hands, exit the room. Next I will do temporal, which is on the forehead. It's just an infrared light that reads the temperature of the skin on the forehead. I will get the temporal thermometer. I will make sure that it's on. I will hold it flat against the forehead. Some models you'll just have to do flat against the forehead and across the forehead to the temple. Some models you will have to lay it flat across the forehead and then go back behind the ear and then release. The whole time when you're doing the sliding, when you're when you're sliding across the forehead, you want to hold the button in and then go behind the ear and then release the button. Read the temperature. Once again, go through all the steps and go out and record the temperature. Axillary will be using the, once again, the oral thermometer. Axillary is under the arm. I will take it out of the thermometer, take the probe out of the thermometer, put a cover on it, place it just under the armpit here and have them hold it close to them. I will kind of hold it in place until it beeps. Once it beeps, I will pull it out. I will read the temperature. I will dispose of the probe cover, put it back into the thermometer, go and record my temperature. Once again, I'll go through all the steps before I enter and before I exit. And the last one will be a rectal. Rectal thermometers are usually red. The oral thermometer usually has a blue probe, which is oral, and a red probe, which is rectal. So, of course, I want to come in, explain the procedure, provide privacy, wash my hands, put on gloves, of course, because I'm going to be doing a rectal thermometer or temperature. I will ask the patient to lay flat on their side, get them comfortable, kind of push their leg, bend their one knee up. I will put the probe on, make sure it's on, put the probe on the rectal thermometer, which is red. I will pull that out. I will put about an inch and a half worth of lubricant on the end. I will have them, like I said, bend their knee, lay on their side, bend one knee forward, the top knee, and then I will expose the anus and I will insert the thermometer about 1 to 1.5 inches into the rectum until the thermometer beeps. I will slowly remove the thermometer, dispose of the probe top, or the cover, read the temperature, set that aside for cleaning. I will also take wipes or some toilet tissue and clean up the area of that on their bottom. Provide privacy again, cover them up. I will take my equipment, I will go clean it off, disinfect it, whatever the policy is for any of the places that I would be employed. I would go out after I remove my gloves, wash my hands, and I would record that rectal temperature.